Legal and regulatory aspects of e-prescribing. E-prescribing is not only a technological advancement, but also a complex legal and regulatory area that ensures patient safety, privacy, and compliance with health laws. The legal framework governing e-prescribing varies across countries, but certain regulations and standards are universally recognized to ensure secure and accurate electronic prescriptions, particularly in the U.S. Healthcare providers must adhere to specific rules to prevent legal violations, ensure patient safety, and maintain privacy. 1. E-prescribing regulations and compliance, e.g., HIPAA, DEA, and CMS. E-prescribing systems must meet various regulatory requirements to ensure patient confidentiality, medication accuracy, and safety. In the U.S., key regulations include the Health Insurance Portability and Accountability Act, HIPAA, the Drug Enforcement Administration, DEA regulations, and guidelines from the Centers for Medicare and Medicaid Services, CMS. 1.1. HIPAA, Health Insurance Portability and Accountability Act. Purpose: HIPAA is primarily concerned with the protection of patient privacy and the secure transmission of health information. It requires healthcare providers and entities, including those involved in e-prescribing, to safeguard the confidentiality, integrity, and availability of patient data. Relevance to e-prescribing. Data. Encryption. E-prescribing systems must implement strong encryption methods when transmitting prescription data to ensure that sensitive information is not exposed or tampered with during transmission. Access control. HIPAA mandates that only authorized personnel can access or modify patient records, including e-prescriptions. Audit trails. Healthcare providers must maintain an audit trail of all prescription activity, including who prescribed the medication, when it was prescribed, and any modifications made to the prescription. 1.2. DEA, Drug Enforcement Administration. Regulations. Purpose: the DEA regulates the prescribing of controlled substances to prevent abuse and ensure safe dispensing practices. E-prescribing of controlled substances must comply with DEA standards to prevent fraud and misuse. Electronic Controlled Substance Prescribing, EPCS. The DEA's EPCS rule governs the electronic prescribing of controlled substances. It includes guidelines for identity verification. Healthcare providers must authenticate their identity before prescribing controlled substances electronically. This is achieved through secure methods such as multi-factor authentication, MFA. Audit and reporting. Prescriptions for controlled substances must be documented and monitored, ensuring that the prescribing provider is accountable for the prescription. Regulated transmission. E-prescriptions for controlled substances must be sent to the pharmacy in a secure and verified manner to ensure they are not intercepted or altered. 1.3. CMS, Centers for Medicare and Medicaid Services. Purpose: CMS is responsible for the regulation of healthcare delivery and payment systems, including the Medicare and Medicaid programs. E-prescribing is closely regulated by CMS to improve medication management and reduce fraud, waste, and abuse. Relevant guidelines. Meaningful use. E-prescribing is an integral part of the Meaningful Use Program, which incentivizes the adoption of electronic health records, EHRs, and e-prescribing systems. Healthcare providers must meet specific e-prescribing thresholds to receive incentive payments under this program. Medicare and Medicaid compliance. E-prescribing must adhere to CMS standards, particularly when it comes to ensuring that prescriptions are accurate, necessary, and appropriately documented. CMS sets specific requirements for e-prescriptions, such as including all necessary patient and medication information. 2. Electronic Controlled Substance Prescribing, EPCS, and its legal implications. The prescription of controlled substances, such as narcotics and stimulants, presents unique legal and regulatory challenges due to the potential for abuse and diversion. The Electronic Controlled Substance Prescribing (EPCS) regulation, issued by the DEA, was a significant step toward allowing the electronic prescription of controlled substances while ensuring the prevention of misuse. 2.1. Legal requirements for EPCS. Two-factor authentication. 2FA. EPCS requires healthcare providers to authenticate their identity using two-factor authentication. This typically involves something the provider knows, e.g., a password, and something they have, e.g., a secure token or biometric scan. Secure digital signatures. E-prescriptions for controlled substances must be signed digitally to verify their authenticity. This signature ensures that the prescription has not been tampered with and is legally valid. Audit and record keeping. E-prescribing systems for controlled substances must maintain records of all prescriptions, including details about the prescribing healthcare provider, the patient, and the medication. These records must be available for review and reporting, ensuring compliance with DEA regulations. 2.2. Impact on healthcare providers. Prescribing restrictions. Healthcare providers are required to register with the DEA and comply with its standards for prescribing controlled substances electronically. Failure to comply with these regulations could lead to penalties, including fines or revocation of prescribing privileges. Pharmacy requirements. Pharmacies receiving controlled substance prescriptions electronically must also comply with DEA requirements, including the use of secure systems and maintaining audit trails. State-specific regulations. Some states have additional requirements regarding controlled substance prescribing, including mandatory prescription monitoring programs, PMPs, that track the dispensing of controlled substances. 3. Secure authentication and digital signatures in e-prescriptions. Ensuring the security and authenticity of e-prescriptions is vital to prevent fraud, protect patient privacy, and comply with legal standards. Two key elements in securing e-prescriptions are authentication and digital signatures. 3.1. Secure authentication. Multi-factor authentication, MFA. To prevent unauthorized access, healthcare providers must use secure methods of authentication when accessing e-prescribing platforms. MFA is a widely used method, requiring the provider to confirm their identity using two or more of the following: something the provider knows, e.g., a password or PIN, something the provider has, e.g., a hardware token or smartphone app, something the provider is, e.g., biometric verification, such as fingerprints or facial recognition. Identity proofing. Some e-prescribing systems also use identity proofing techniques, such as validating the healthcare provider's license status or conducting a background check to confirm their eligibility to prescribe medications, particularly controlled substances. 3.2. Digital signatures. Purpose. Digital signatures are essential for verifying the authenticity of e-prescriptions, particularly when prescribing controlled substances. A digital signature ensures that the prescription is legitimate and cannot be altered without detection. Compliance with legal requirements. According to DEA regulations, e-prescriptions for controlled substances must include a digital signature to be legally valid. This signature must be generated using a secure cryptographic method that ensures the prescription cannot be tampered with or forged. Authentication and verification. Digital signatures are tied to the identity of the prescriber. They ensure that only the authorized individual who issued the prescription can be held accountable for its contents. Enhancing communication between providers and pharmacies. E-prescribing significantly improves communication between healthcare providers and pharmacies, streamlining the prescription process, improving accuracy, and reducing delays. The direct transmission of prescriptions from providers to pharmacies ensures that the medication order is clear, accurate, and promptly delivered to the pharmacy, enhancing patient care. 1. How e-prescribing streamlines communication with pharmacists. E-prescribing systems eliminate the need for handwritten prescriptions and faxes, reducing the potential for miscommunication and errors. Key benefits of e-prescribing include 1.1. Immediate and accurate transmission. Traditional methods. In the past, prescriptions were often hand-delivered or faxed to pharmacies, which could result in delays, lost prescriptions, or errors in transmission. E-prescribing. Electronic prescriptions are transmitted directly from the healthcare provider's system to the pharmacy's system, ensuring immediate delivery. This reduces the likelihood of lost prescriptions and ensures the pharmacist receives the correct information without the risk of misinterpretation. 1.2. Real-time access to prescription information. Traditional methods. Pharmacists would often need to contact the provider to clarify unclear prescriptions or to confirm missing information, such as dosage or instructions. E-prescribing. With e-prescribing, pharmacists can view the entire prescription, including dosage instructions, medication history, and potential allergies, in real time. This reduces back-and-forth communication and allows the pharmacist to prepare the medication more efficiently. 1.3. Integration with pharmacy management systems. Traditional methods. Manual entry of prescription details into pharmacy management systems can lead to errors and time delays. E-prescribing. E-prescribing systems integrate seamlessly with pharmacy management systems, allowing pharmacies to automatically populate patient records with prescription information, speeding up the dispensing process and reducing errors. 2. Handling prescription refills and changes effectively. Managing prescription refills and changes is an integral part of medication management, and e-prescribing enhances the process by improving accuracy and reducing delays. 2.1. Prescription refills. Traditional methods. Refills often required patients to call the provider's office or visit in person for authorization, leading to delays and administrative burdens. E-prescribing. E-prescribing allows healthcare providers to authorize prescription refills electronically, which is sent directly to the pharmacy. The pharmacy can then prepare the medication without waiting for a verbal or written order from the provider, improving efficiency and ensuring the patient receives their medication on time. 2.2. Changes to prescriptions. Traditional methods. When a prescription needs to be altered, e.g., dosage adjustments or medication substitution, the provider would have to manually communicate the changes to the pharmacy, which could lead to errors, misunderstandings, and delays. E-prescribing. E-prescribing systems enable healthcare providers to make real-time changes to a prescription and send updated orders directly to the pharmacy. Pharmacists can immediately receive and verify changes, ensuring that the patient receives the correct medication or dosage without delay. 2.3. Medication renewals and discontinuations. Traditional methods. Providers needed to track renewals manually and communicate changes directly to pharmacies. Missing or incorrect renewal requests could cause patients to run out of essential medications. E-prescribing. E-prescribing allows for automated tracking of medication refills and renewals, alerting both providers and pharmacies when a prescription is near its limit or needs renewal. Providers can electronically send renewal orders, ensuring timely access to medications without unnecessary delays. 3. Real-time notifications and alerts for providers. E-prescribing platforms are equipped with real-time notifications and alerts that help healthcare providers stay informed about the status of their prescriptions and address any issues immediately. 3.1. Prescription. Status updates. Traditional methods. Providers had limited visibility into the status of prescriptions once they were sent to the pharmacy, leading to potential gaps in communication. E-prescribing. E-prescribing systems send real-time notifications to providers when a prescription is received by the pharmacy, when the medication is dispensed, or if there are any issues with the prescription, e.g., out-of-stock medications, dosage conflicts. This provides providers with up-to-date information, ensuring that patients receive the right medications on time. 3.2. Alerts for medication issues. Traditional methods. When pharmacists encounter problems with prescriptions, they often need to contact providers directly, which can take time and lead to patient delays. E-prescribing. E-prescribing systems provide automated alerts to providers when there are potential issues, such as medication contraindications, allergies, or drug interactions. These alerts allow the provider to quickly address any concerns before the prescription is processed, preventing medication errors. 3.3. Patient-specific alerts. Traditional methods. Providers often have limited visibility into the patient's medication history or any potential conflicts between newly prescribed medications and existing treatments. E-prescribing. With integrated e-prescribing systems, providers receive patient-specific alerts regarding drug allergies, drug interactions, and other relevant factors that could impact treatment. This ensures that any medication prescribed is safe for the patient, improving patient safety and care outcomes. 3.4. E-prescribing of controlled substances. Alerts. Traditional methods. Prescribing controlled substances manually can be complicated, with strict rules and regulations governing their use. E-prescribing. E-prescribing systems with integration to the DEA's electronic controlled substance. Prescribing EPCS feature notify healthcare providers when they are prescribing controlled substances. These systems ensure that the proper authentication protocols are followed, and that the prescription is compliant with all legal requirements.